Found it.
Here we go. Yes. Yeah, we just got the recording in progress.
Thank you. Okay. So again, Cindy Reed here with the partnership for Opendoor, which is our virtual resources connection meeting that we host every second Thursday of the month at 7. And for our agenda today, I just did the welcome remarks. Again, welcome everyone. Thank you for joining us. I'll share the partnership overview. We'll share some program updates, whatever events that we have coming up. We have a great presentation that is from NYC Health and Hospitals. And then we, as we always do, we end the meeting with pulling of the raffle gift cards. So all of you that are attending, residents, please put your name in the chat so I can enter you in that at the end, and we can call the winners at the end. Moving along. Partnership overview. We like to share that we perform as a hub, connecting families to resources based on their need. We often get calls about housing, employment, immigration, but it doesn't matter what the family's in need of. We try our best to connect it to services that's in the community. And we also host events that also provide opportunities for residents to be connected to resources as well. Now I'm going to share our monthly meetings. You're already attending one, Opendoor. This is a virtual meeting that is hosted on the second Thursday of each month at 7 p.m. And we also have our general meeting, which is hosted on the fourth Thursday of each month from 3 p.m. to 5 p.m. and is currently available hybrid, which is available via Zoom, and in person, which is hosted at this moment at My Time Inc., located at 640 Parkside Avenue. Now for some updates, we have a current emergency food drive in partnership with Flatlands Reformed Church. We're collecting, sorry, give me a second. Sorry about that, everyone. So as I was sharing, we in partnership with Flatlands Reformed Church, we are doing an emergency food drive to provide to families that are in need. So if you have any perishable food, canned goods that are not being used, that are still good, you can drop it off at the church. They're located at 3931 Kings Avenue, and you could drop it off between Tuesday, Wednesday, and Thursday between the hours of 10 a.m. to 1 p.m. We appreciate your support in that, and also sharing that. If you don't have anything, you could also share with someone who may have to give. We have our annual gingerbread house decorating party that will be taking place on December 6th, which is a Saturday, 11 a.m. to 2. It's going to be located at 1805 Nostrand Avenue. This is a fun time for families, so we encourage you to share it and have the families come out and join us for this great time. We have hot cocoa, and I always like to say hot cocoa done the right way. And we encourage all families to arrive by 1 p.m. the latest to receive their kits. And registration is open for that right now. Next, we have our Christmas toy giveaway in collaboration. Wait, before I go, let me go back. I just want to highlight the partners for the gingerbread house. That's Zochic, Sesame Flyers International, Arts and Public Speaking Program, and Real, which is an after-school program. And then for the Christmas toy giveaway, that's in collaboration with Flatlands Reformed Church, Flatlands Community Partnership, NYPD 63 Precincts, and the Customs Control Board. This is happening on December 20th from 12 p.m. to 4 p.m. at 3931 Kings Avenue. Toys will be provided, games, food, and fun. It's a great time for families, so we encourage you to share this as well and join us that day. Now coming to our presenter. Again, we have NYC Health and Hospitals that's going to be presenting on heart health today. We have Ruth on the line. Ruth, can you hear me?
Yes. Can everyone hear me?
So Ruth, I'm going to stop sharing. You could take over and put your presentation up, okay?
Yes.
Thank you so much.
Thank you. So, hi everyone. Good evening. Thank you so much for having me. My name is Ruth Horry. Among the many hats that I wear, I work with health and hospitals, specifically Kings County Hospital, to share information on the new program that has been developed, um, and just share information about heart health. And so I'm going to share my screen. Oh, I think I need permission to share.
Okay, fixing that right now. Second. Okay, you should be able to share now. Sorry about that.
No problem. Oh, right.
While she
So,
puts up her presentation, sorry, Ruth, I want to remind everyone to put your name in the chat so I can enter you in for the raffle that will be called at the end of the meeting. Thank you.
so I'm going to put a link in the chat. So this survey can be filled out now. We usually like to do this survey before we do the training because we just want to know what folks know before we go in. So if you could just take the next 2 minutes to click on the link that was put into the chat, and fill out the survey. Please let me know if anyone's having trouble accessing the survey.
The link, are you able to put the link in the chat room?
Did you guys see it? Hold on 1 second, I'll put it again.
Yes,
Okay.
Cindy, I saw it.
Okay. All right, I'm gonna give everyone about 1 more minute because it's only a couple of questions. All right, so I'm gonna go ahead and get started. Thank you everyone for filling out the survey. So this program was created because Black and Brown women in the United States die during childbirth at a higher rate than most countries. And it shouldn't happen. A lot of it stemmed from racism, and those practices, and just Black people not being heard. And so Black doctors within Kings County who have been tired of watching Black women come in and not leave to go home with their families after giving birth, developed a program and started to figure out what was happening and found out that it was heart trouble and decided that they wanted to partner with cardiologists to make sure that Black women live. And so this program is not something that the city jumped on last minute because this became a popular issue. This is funding that was given to Black doctors who've been doing this work for a long time. So I just always like to say that before I get started. So right now I'm going to talk about general heart health, for things everyone needs to know. And then I'm going to move into the all eyes on mom, as I like to call it, because it's everyone's job to make sure that Black voices are heard. 6 to 23 months. Anyone pregnant or postpartum. So why heart health matters for all of us. Heart disease remains the #1 cause of death in the United States for both men and women. Most people assume heart problems look like sudden dramatic chest pain, like we see in the movies. But for many adults, early symptoms are subtle and easy to overlook. Our goal is to make prevention feel practical and not overwhelming. So major risk factors to pay attention to. So there are big categories that increase a person's chances of developing heart disease. And they apply across all age groups. So there's medical risk and then there's lifestyle risk. So for medical, high blood pressure, elevated cholesterol, diabetes, or pre-diabetes, as well as obesity. And those are the things that sometimes you just can't control. But for lifestyle, smoking or vaping, high stress levels, poor sleep, diets that are high in salt, sugar, or ultra processed food, as well as low physical activity. So having one of these increase your risk, and most people have at least one, which means that making sure people are aware is really critical. So early signs, most people ignore. These symptoms often show up weeks or months before a major cardiac event. Unusual shortness of breath during activities that used to feel easy. So you used to be able to climb that one flight of steps to your apartment, but now you feel like you've just climbed a mountain. Fatigue that feels different or out of proportion. Um, Chest discomfort, pressure, tightness, pain in the jaw, back, shoulders, or the upper stomach area, as well as dizziness or faint or feeling faint. Heart palpitations or irregular heartbeat, which means like your heart feels like it's beating out of its chest. Um, Swelling in the legs or feet. And women in particular often report non-chest pain symptoms. So they're having things like nausea and back pain or sudden fatigue. So when is it time to seek care? So you do not need dramatic symptoms to take action. Um, Patients and themselves, people need to get checked out regularly in general. So if you're experiencing any of these symptoms, new or unexplained shortness of breath, chest pain that comes and goes, persistent swelling in the lower body, heart racing or skipping beats, or any symptoms that feel off or that last more than a few days. And then just finally, quick prevention tips anyone can start today. So you can move your body at least 20 minutes a day. Reduce sodium and ultra processed food, drink more water than sugary beverages. So it's not saying don't, but if you're going to have something that's sugary sweet, you should have more water to go along with that throughout the day. Check blood pressure regularly, know your cholesterol numbers, and if you are able to reduce smoking and alcohol use. So even small improvements can really add up. So before I move on, does anyone have any questions? Okay, so I'm going to move on to our main presentation.
Sorry, Ruth, that we just have a few people that just joined. Just letting them know, if you want to be entered in for the raffle at the end, please put your name in the chat. Thank you.
I was
Yes.
just on Cindy. I got kicked
Okay.
off. Sorry.
And I have a question too.
Yes,
You
please.
asked what are the how should I put this now? When taking aspirin, if you feel like they always say you should have like the baby aspirin, you could take that if you're feeling a chest pain.
And so what I like to say is that if it's something that is out of the ordinary, I would say that get checked out. Like, so I'm not a doctor, so I'm not going to say take aspirin or not, but I would encourage people that are Black and brown to take the next step and go get checked out if you're able to, and bring someone with you. Um, we find that, going with someone, people are a little bit more accountable and your symptoms aren't overlooked because there's someone there to advocate for you. Um, Once in a while headache is one thing, but sudden chest pain, sudden headaches that just won't go away. Even the smallest thing, I would say just going to the doctor on a regular basis, which sometimes we got the kids, we're taking care of everything else but ourselves. I was guilty of that. When I first started doing this training a year ago, the first thing I had to do was make a doctor's appointment because I realized I hadn't been to the doctor in 7 years. Like I take care of my kids, I don't miss not one appointment, but for myself, I just stopped going. So how can I tell people to take care of their heart if I'm not taking care of mine? So I definitely would say like those annual checkups and all those things, it's really important not to put yourself second.
Yeah, thank you. That does make sense.
No, I appreciate the question. Um, So just wanted to highlight the doctor that I was speaking about earlier. This is Dr. Suzette Graham Hill. She is a cardiologist and internalist, and the director of the cardio OB practice at Kings County Health and Hospital. Another thing that I like to mention, we already did the pre-survey, is a lot of people just by nature judge hospitals by the emergency room. And so I will be the first to tell you that I may not be the biggest fan of the Kings County emergency room, but it is an emergency room, which means it's hectic and there's a lot going on. But I can tell you that upstairs on the floors where the cardiologists are and labor and delivery, these are the people that are on that team. And I know them well, and they are there to support Black women, and they are there to make sure that women are safe. So I can vouch for that portion of it. So today's plan, why do women become ill and can potentially die? We're going to focus on 4 main categories: cardiovascular health, high blood pressure, cardiomyopathy, as well as stroke. Pregnancy is a stress test, how you can access care, and then how to communicate concerns and support each other. This program launched or received funding earlier this year, in March. So again, we talked about the racism that is involved. So a lot of the policies and practices that reinforce racist standards within a workplace or an organization. So this is on an institutional level, a structural level, an interpersonal level, as well as an internalized level. I can remember going to, I was pregnant with my youngest child, and I was babysitting 2 other children, and I was having contractions. I went into the hospital, and first thing the doctor said is, "Oh, you're having another one." Those weren't even my kids, but even if they were my kids, like the microaggressions and the way that we're talked to and treated is it makes a difference. I decided that day that I didn't care where I gave birth, even if it was on the street, I wasn't going to my nearest hospital. And that's a problem, right? Because the longer I wait in labor and to go further puts me and my child at risk. And so addressing these issues is really important. So maternal morbidity and mortality, and so that's death, in New York, in the United States. So having a baby is usually safe. Women have been doing it for generations. Sometimes it can be more risk with having a baby. Having high blood pressure or an unplanned cesarean, known as a C-section, can make the process more risky, but more mothers die in childbirth in the United States than any other wealthy country. About 22 out of 100,000 mothers die each year. And because of racism, deaths are more common for Black mothers. About 49 out of 100,000 Black mothers can die in the United States. So almost half of the deaths around pregnancy can happen within a week to a year up to delivery. That's something I learned throughout this training. I'm thinking mom is safe when she gives birth. That's not the case. Most of the deaths that are happening, or almost half, which is 47%, are happening up to a year after the baby was born. Major causes of death among Black mothers are heart-related problems like high blood pressure. So in addition to the everyday stresses of life that women experience, now they're experiencing the physical changes of pregnancy, especially around the amount of blood and the work that their hearts need to do. This can reveal underlying problems or cause new ones. So again, high blood pressure is anything greater than 140/90. And so this chronic hypertension is high blood pressure that is found before pregnancy or in early pregnancy. Preeclampsia is high blood pressure with signs of liver or kidney problems. Gestational hypertension is high blood pressure that is found after 20 weeks of pregnancy, so halfway through. This is usually at the 5-month period when you're finding out if it's a boy or a girl, and they're having you drink that solution, and that's the test to find out. As well as eclampsia, a condition where high blood pressure leads to seizures. So high blood pressure can lead to preterm births, smaller babies, as well as C-sections. And And can it be treated? So the good thing about all of this, and the sad part, is that women are dying for no reason, because there's a cure for all of these things. So for people with a history of preeclampsia or chronic hypertension, aspirin can be used. And so someone on the call mentioned that, and it is true. But going to a doctor so that they can say, okay, this is it, you're safe to take this, and simple as that. Can be used to prevent preeclampsia in current and future pregnancies. For people with hypertension who develop hypertension while they're pregnant, there are blood pressure medicines that can be used. And for people diagnosed with severe high blood pressure, eclampsia, or eclampsia, there's a magnesium sulfate that can be administered in the hospital that can prevent seizures. Because at the point when your blood pressure is that high, your blood is boiling, you're going to start to seize. Risk factors for both pre and eclampsia are: this is your first pregnancy, being younger than 18 years old, over 35, being overweight, having family with high blood pressure or preeclampsia, diabetes, kidney problems, multiple births, lupus, and of course, smoking and substance abuse. The effects of high blood pressure after pregnancy. So it's chronic continued high blood pressure after the pregnancy is now considered hypertension. Heart damage and heart failure, stroke, and death from heart problems. So cardiomyopathy is an enlargement of the heart muscle that causes it to weaken. Cardiomyopathy is usually diagnosed in the last month of pregnancy and up to 5 months after pregnancy. I'm not sure if during the pandemic, anyone is familiar with the movie Aftershock. Um, a prominent figure in Brooklyn during the pandemic, her daughter gave birth, had complaints, there were concerns, and they weren't addressed, and the mom died. The father was devastated and got together with a few other dads who experienced the same thing. And they created a movie. It's really powerful if you ever have the time. And they're from Brooklyn. It's called Aftershock. And a lot of you, I think her mom's name is Shawnee. Some people on the call may even know her. But it was really powerful. And so this is happening, this happens all the time, right in our neighborhood. And so this is really important. All eyes on mom, because the healthcare professionals are not. So we have to stay informed and together. So for cardiomyopathy, the risk factors: having high blood pressure, again, it can be treated with blood pressure medications. If you're having multiple births at once, there's medication to help thin out the blood. Over 35, there's medication to reduce fluid retention. But if these things don't happen, it leads to heart failure and ultimately death. One that we're a little bit more familiar with on the call is stroke. A stroke is a brain attack when something blocks the flow of blood to the brain. So risk factors are having a history of high blood pressure or preeclampsia. Again, blood pressure medications that can be used. History of stroke, there are medicines to thin out the blood. And high cholesterol or diabetes, there is medicine that can reduce the fluid retention. And of course, if not, it can lead to heart failure or death. With a stroke, it's immediate. Like, if the faster you can get that person to get care, the faster that they can hopefully reverse some of the damage. So warning signs are headaches that won't go away, upper stomach or shoulder pain, sudden weight gain or swelling, blurred vision, nausea or vomiting that doesn't go away with treatment. Cardiomyopathy specific warning signs are feeling short of breath with light activity. You got up from the couch and went to the refrigerator and you feel like you've walked a mile. Breathlessness when you're laying down. You're laying down and you feel out of breath. Feeling like your heart is skipping beats. Chest pain, tightness, swelling of the ankles and feet, increased urination at night, and cough that doesn't get better with cough medicine. And again, for the stroke, sudden numbness in your face. You ask the person to smile and only half of the face goes up. Unequal arm movement. You ask them to lift both arms. They only lift one, but they're trying to lift the other. Slurred speech, sudden confusion. You ask them what's today's date, what their name is, and they can't remember. If you're having any of these symptoms and feel like something just isn't right, call 911 or go to the emergency room. Better safe than sorry. We know that better communication can improve care. And so I just want to thank everyone for taking the time to listen to the presentation. I am going to drop a link in the chat for the post survey. This helps me know if we're doing a good job. I like to tell people, please be very, very honest. We want to hear it was too long. We hated the colors. Whatever it is that you're thinking, please. Or if you learned something today, definitely share it because it just helps us know that we're going in the right direction. We take in all the feedback and we definitely make adjustments. But again, thank you so much, Cindy, for having me. I'll open it up for questions if anyone has any questions, and then I will turn it back over.
Thank you for that. I thought it was going to be longer. But that's
No,
okay.
and I think I was moving fast because I had created the second one to make sure that I, tried to cover for all for everyone in general. But I do feel like I do these presentations for men, fathers groups, because I feel like it's important that once we have the baby, everyone is watching the baby, but who's watching mom? And so maybe dedicating that one person within the family that after the baby's born, this person's going to make sure that mom's still eating, that she goes to that 6-week checkup, that they're checking in with her to see how she's feeling, because these deaths just shouldn't be happening, especially the way that they are in a country that is medically as advanced as we are. But I do see someone's hand up, D.
Wow, great presentation. I didn't get your name.
My name is Ruth Horry.
Oh.
I'll put my information in the chat for everyone. I work with health and hospitals, and I also work for United for Brownsville. We support families with children 0 to 5 who need help with early intervention. I'm usually the person people come to when they need resources, so things like Pampers, wipes, food. Um, Happy to help.
Yeah, great presentation. Also, I noticed that most of the presentation was about pregnancy in terms of some of the risk and symptoms, but couldn't that also be for just someone that isn't pregnant?
Yeah, all of them. And a lot of them, so in like the second or third slide, it mentioned how they reveal underlying things that were already there. So a lot of the times mom already had high blood pressure. She just didn't know. But now that she's pregnant and going to the doctor, they're there to test those things. And so it's important for us as men and women because heart disease is the #1 killer across the board, across men and women. So hearing these, continuing to hear these symptoms so that they become second nature. Like I feel like a stroke symptoms are second nature. I've been hearing them forever. And so if I were to see it, I would know how to jump into action to help someone. Like I know 911 now. Um, but learning with cardiomyopathy, I'd never heard of that before, but that's what my friend died from. And so it's just like letting people know that all of these things exist. Pregnancy just makes them worse in a lot of times.
And you, one of the slide, excuse me, one of the slides that mentioned about swelling in the feet. Now, is it both, or could it be swelling in just one?
So I would say if you have any concern with any of them, even if it is just one, to go in and see a doctor and say I have this concern. And I would also suggest if you have someone that can go with you to advocate for you, so that you're not disregarded or I, I go to the doctor with my grandmother all the time because of this. She'll say she has a certain issue and they're like, "Ah, you're old." And I'm like, "Ah, no, we're going to address it." Because it doesn't matter if she's old. She's here, she paid for this appointment, and this is what she's experiencing. So it doesn't mean that I have to, come in swinging, but I'm there to firmly stand and say, "No, I need you to listen to this person." So I always suggest bringing someone. But the team at Kings County, I can't speak for any other hospitals, but Kings County, that team on that floor is waiting for people to come in, and they are there to support them.
So the doctor that you listed in the presentation, they're currently taking,
Yes.
the cardiologist is currently taking new patients?
Yes.
Oh, okay. I live like 3 blocks from there, so.
Yeah, definitely. I can vouch for them because I know that the team, we're supposed to be expanding to another hospital next year. Um, but this team they're just tired of watching people die, and they've been working on this for years. They just now got funding. And so part of that is we got to get this on both sides. We have to educate people about the signs and symptoms, and on the other side, we have to change the way the hospitals are responding to them when they show up.
Okay, thank you. And I guess I can find the information for that doctor, I guess, on the Kings County website.
Yes, I'll put
Okay.
her name in the chat as well.
Okay, thank you so much.
Yes.
Someone asked us, can they get a copy of the slides? Would we be able to share the slides with the presentation?
I can reach out to my supervisor and see if that's okay, because I'm contracted and a lot of this is like their materials. I don't see why not. But I will ask and follow up with you and share it out. I also have a flyer that I'll email you. So if people want me to come, I do these presentations all over the place. I do them in the community. So I'll come to the local church. I'll come to your family group. So if anybody on this call is interested and they're like, hey, this is great information, I'd love it to bring this information to that space, let me know. I put my email in the chat. Please feel free. And I see another hand up.
Yes, this is George State, and thank you for the presentation. It was a great presentation. And but before I even get into that, I just want to, what I'm going to say, I do have a comment to make sure, because someone mentioned the aspirin regimen. I just wanted to make sure that advise you not to go into an aspirin regimen without consulting a doctor. Okay, because these a side effect of that it could destroy your stomach. Okay, and that it happened to me. I was thinking that they had put me into a aspirin, and then they had to stop it because it was affecting my on their own. Because normally what they're giving is baby aspirin. So that said, I just gonna say that I really appreciate this presentation, especially out of the four men and my father, my brother, my father, both brothers died basically from heart heart problem, including one that just died. My older one died 2 weeks ago.
I'm so
But
sorry to hear
I'm
that.
the only. Thank you. I'm the only one remaining for the minute in the family, and so I try to watch my diet because I'm also diabetic. So this really coming very important, and I may take you up in that trying to see because I do have a cardiologist, but it's a different Mount Sinai. It's affiliated Mount Sinai. This sounds very interesting to ask the same thing that someone asked. The name of the cardiologist over there. But you say you will send everything to Cindy and then she could send it out.
Yes,
But
I can
thank
definitely share. And thank you so much for sharing. I definitely agree with the aspirin always that so with this is not to learn how to diagnose yourself, it's to get into the doctor's office. One of the biggest things that I feel
right.
Black people shouldn't have to figure it out what's wrong with them. They should get the same service that other people go. They go to the doctor and they help them figure out what's wrong. And so I don't want you to
Yeah.
walk away from this presentation saying, okay, what are the signs of cardiomyopathy? I want you to know something's wrong, go get help. If you think it might be, you're worth getting it checked out. Um,
Yeah.
Rather have them tell you no, everything is fine, or like you said, if aspirin is okay, they're always gonna weigh the good and the bad, and everybody's body is different. And so for me, it may rip my stomach to pieces, but what I'm more at risk for a heart attack, so they'll say, okay, we're gonna take that because we don't want you to have a heart attack, but we're gonna give you something else to help with your stomach. So, and then there's some people, they say, okay, you know what? The benefit is greater or it's not. So definitely go into the doctor because they'll be able to see your chart. They'll be able to know exactly what works for you. So this is not medical advice. This is more just knowing that when something's wrong, you need to get help and that there are doctors at Kings County that are waiting to help. And hopefully as the years continue, we're in every public hospital.
Thank you, thank you.
And definitely condolences for your loss.
Thanks.
Well, I thank everybody for
Wait, sorry, I have a question.
Oh yes, please.
Do you know, are there any known deficiencies in certain nutritions that may be leading to it as well? Has anything come up with that?
No, I think so. A lot of this, again, it's racism, and that's really the saddest part about it. None of these signs and symptoms, they're happening, they happen to anybody. You know, this is not just about pregnant people, but what tends to happen in the United States due to racism is that Black people are not listened to. It was once thought that Black people tolerated more pain, and that was taught in a medical environment. And so when a Black woman says it hurts or I'm in pain, it's not that bad. And that turns into she's not here anymore. And so definitely like advocating to change and the bias that people have when they show up, because this is the training for the community, but there was also a whole nother training for the hospital staff so that people are treating people like people, like, yeah. So I hope that answers the question, but this is a trying to get this from both sides, and you should be able to go to the doctor, but unfortunately, everything is not perfect. So suggestions would be to go to someone with you, so that someone is there to advocate and put their foot down and say, no, this person said they're in pain, and we need to do something about it.
I think the other thing also, it's just so difficult to find Black doctors in the different specialties, whether it's cardiology, GYN, or endocrinology. They're just not there. Most of the doctors you see when you go to Doc or anything, it's mostly, you know, white doctors, Russian, whatever. It's just hard to find them. And the other thing is, I think that, I don't know if we were raised that way or whatever, that we just, were taught that, listen to the doctor. No, the doctor's not always right. We can question the doctors. Like we look at them as someone in authority. And okay, yeah, they went to school, but you got to ask questions, whether they're the doctor or not. And then if they're not listening to you, I know for me, I just say, listen, I hear what you're saying, but you're not hearing what I'm saying.
Yeah, thank you so much for sharing that. So I would say two things. For the first one, a lot of it is insurance. A lot of our Black and brown kids that, make it through medical school and they get the degree, they can't afford to work in their community because of the pay. And so they end up having to work outside of their community, or it's issues with insurance. And so the second thing, I lost my train of thought, but I had something I wanted to comment on the second one. Um, so about them listening to you. So what I tell people is the same thing with lawyer, because I work with young people who juvenile justice, and the the lawyers not paying attention, and they're paying these people. Listen, your doctor, you are hiring. You have a right to change, choose,
That's right.
say, I want a second opinion.
Yeah.
You're hiring someone to do a job for you, essentially. And so they go to school to get this skill so that they can perform this service. And so, yes, you have a right to say, hey, that doesn't sound right. And if that back and forth is not going in a way where you feel like you're being heard, it's time to get a new doctor, because ultimately you're hiring that person, and whether you have Medicaid or not, because they're getting paid, right? And so it's not for free. Nothing is free. So yeah, I firm believer of, and then we need to share as a community. When you find a good doctor that's listening to you, share that with
Yes.
your neighbors. Let people know, this place. I'm listened to when I go here. My concerns are heard.
And then also we have to try to educate ourselves as well. I know my doctor always says, "Dee, stay off the internet." I said, "No, I go to like Mayo Clinic, and I'm not going to like these little, but I'll go to like Harvard or Mayo Clinic to try to figure out, okay, this is what the doctor told me. Okay, what exactly does that mean?" And so I try to educate myself as much as possible, and then always write down the questions before you go, because 9 times out of 10, you're gonna walk out of there and say, "Oops, I forgot what to ask the doctor this."
Yeah, I definitely tell people, make a list and don't miss not one thing, because again, you're paying for this. So don't feel afraid to ask all your questions, because that's what you're there for. Um so yeah, like I said, I love the conversations afterwards, because you get to like talk about like people's experiences, and I do this because I've experienced it. So I really appreciate everyone like sharing their comments and their thoughts, and like it helps with the presentation as well. But Cindy, I don't know if you have any more questions, but I am going to end here. But thank you so much, everyone, for giving me your
Thank
time.
you.
I appreciate it.
No, this is great. Thank you so much. And I hope everyone's being mindful because, like you said, using all your time. Doctors are supposed to meet with you for an hour, but they're trained to do it within 15 minutes and not even meeting with you in those. They be doing it in 5, 10, and still getting that full paycheck for that meeting. So I try to myself, even when I'm going, my doctor, have my questions and take my time. And I've had doctors who had to take a step back. Oh, this is a different kind of patient when they're trying to rush me out. So I appreciate that, and I hope everyone enjoyed the information that was shared. Right now, I just want to check with everyone. Did you get a chance to put your name in the chat for the raffle so we can check our list before we call the raffle winners?
Thank you so much, everyone. Have a wonderful evening.
You too.
Thank you, Ruth, for that great information.
Thank you, Ruth.
Did everyone get a chance to put their name in the chat? I'll give it a minute just in case anyone